In my time doing Medicare, I've come across a lot of unique situations, and some of those are people having original Medicare but no supplement plan, or people thinking they had signed up for Part B and they hadn't. And then situations like the one I'm going to share with you in today's video, where people just plain didn't sign up for Medicare and it cost them. So I came across this news article this morning that came out kind of as breaking news around Medicare, and I thought I would share that with you here. The title of the article is Her Ambulance Ride Wasn't Covered by Medicare, and it will cost her family $81,000. So in this video, it's talking about a retired worker who was careful with her money, including what she spent on medical care. This is according to her daughter, Alicia Weberg. She was the kind of person who didn't go to the doctor for anything. That ended last year when the rural Tennessee resident suffered a devastating stroke and several aneurysms. She twice was rushed from her local hospital to Vanderbilt University Medical Center in Nashville, 79 miles away, where she was treated by brain specialists. Unfortunately, she died October 31st at age 70. One of Pritchard's trips to the Nashville hospital was via helicopter ambulance. Weberg said she had heard such flights could be pricey, but she didn't realize how extraordinary the charge would be or how her mother's skimping on Medicare coverage could leave the family on the hook. Then the bill came, and then they show you a picture of the bill that the total was $81,739.40. So the patient had Medicare Part A, excuse me, who had Part A insurance before she died, the medical service, an air ambulance flight to Vanderbilt University, and then the service provider, which oftentimes is a third party for these ambulance rides, was MedTrans Corporation, a medical transportation service. The total bill again was $81,000. So why? Sky high bills from ambulance providers have sparked complaints and federal action in recent years. My family has experienced this personally. My father in law lives in a rural part of Minnesota, and not once but twice he has had to use an air ambulance system. And he does have Medicare. He actually has a Medicare Advantage plan, so the cost is capped at his maximum out of pocket for the year. But a lot of people don't think about this, especially if you live in a rural setting. And so it goes on to say that talks just a little bit about um, the fact that she did not take Part B, and it talks about the fact that she was in a rural area, and that the single helicopter ride could eat up roughly a third of her estate's value because she was only enrolled in Part A. She declined Medicare coverage, including Part B, which handles such things as doctor's visits, outpatient treatment, and ambulance rides. So that's something, if you're on Medicare, you want to remember. Her daughter suspects she skipped the coverage to avoid the premiums most recipients pay, which currently, in this person that wrote the article didn't know the exact amount, but it's 174.70 in 2024. Then it talks a little bit here about how Lauren Adler, a health economist for the Brookings Institute, estimates the maximum charge that Medicare would have allowed for Pritchard's flight would have been less than $10,000 if she had signed up for Part B. The patient's share of that would have been less than $2,000. And again, obviously, her estate would have paid nothing if she would have had a Medicare supplement plan. So if you want to read this article in greater detail, I'll leave a link to it in the description of this video. But in my experience, a lot of the people that I talk to on the front end of transitioning to Medicare all boast about their health. I haven't been to the doctor in years, and do I really need Medicare? Do I really need Part B? Do I really need a supplement? I'm healthy as a horse. That's how we all like to think of our lives. We like to think that bad things happen to other people. But as you can see from this news story, it always happens to somebody. And if we believe that we're immune from that, we're deceiving ourselves. We're being foolish, quite honestly. And so you really want to make sure that you're taking the steps in retirement to protect your financial future, much of which centers around your health insurance. So anyways, just a quick video today back in the studio. The cold air is coming back. Let me know what you think about this video in the comments below. I appreciate you watching, and I hope you have a great day.